Good day. I am Eloisa Farnea Bordas and I am going to perform the two hand positionings that are routinely practiced during an X-ray procedure of the hand. Let's begin with the PA projection of the hand. The patient must be shielded on a seating position at the end of a radiographic table. Then, we must prepare an 8 by 10 inch or 10 by 12 inch image receptor. Basically, an 8 by 10 inch image receptor is used if you want a single image of a PA projection of the hand. But if it is intended to take two images in a single cassette of PA projection of the hand, just like this, the 10 by 12 inch image receptor is utilized in a crosswise position. So let's pretend that this white bond paper is the 8 by 10 inch image receptor. The patient's forearm must be rested on the table with the palm facing down the image receptor, just like this. We must make sure to separate the digits in order to avoid lapping of each of the tissue of the distal phalanges. Next is the patient must be instructed to not create any movements and to stay still. If the patient is a toddler, a sandbag may be used to avoid any movement. The central ray must be in the third metacarpal joint. So, let's say for example that this is the crosshair. So the central ray must be on the third metacarpal joint. Adjust the collimation to include or show the distal radius and ulna on the inferior side and the tip of the distal phalanx. So basically, the collimation must end within this area of the forearm, which contains the distal end of the radius and the ulna, and must also begin on the superior part on the distal end of the phalanx. Lastly, place a marker on the lateral part of the extremity that shows whether the hand is left or right. The next projection that I will show is the PA oblique position. The patient must be shielded on a seating position at the end of a radiographic table, just like the PA projection. And then, we must prepare an 8 by 10 inch image receptor. So again, let's pretend that this white bond paper is the image receptor. Place the hand on the IR. Place the hand on the IR The PA oblique projection can be positioned with the use of a wedge to make sure that it is on a 45-degree angle. For example, this power bank is a wedge. So it can be put right here so that the hands will be guided that it is on a 45-degree position so that it can be called an PA oblique projection. But another way to obtain a PA oblique projection of the head is by performing the pronated position, just like this, and rotating the patient's hand laterally, externally. We must make sure that the tips of the fingers must touch the hand, must touch the image receptor. So in this way, we can show an oblique, PA oblique projection. The next step is to place the crosshair or the central ray on the third metacarpal joint, which is in this position. Then again, just like in the PA projection, must adjust the collimation to include or show the distal radius and ulna on the inferior side, and on the superior side is the tip of the distal phalanx. Lastly, again, place a marker on the lateral part of the extremity that shows whether the hand is used, whether the hand that is used is on the left or the right side.